This presentation is part of a pain management educational series offered by our clinic. This particular presentation is going to be a review of the medical agreement that is used in our clinic. Compliance with this agreement will help to guarantee and ensure your continued access to treatment. Many federal and state agencies have developed guidelines for the use of opioids and other controlled substances in the treatment of chronic pain. It is going to be important to understand the aspects of these guidelines and to be able to follow them. The medical agreement outlines these guidelines as well as the patient responsibility for following the guidelines. Non-compliance with these guidelines could result in suspension or discontinuation from treatment. So in order to be able to continue treatment and have access to it, we want you to have as good of understanding as you can as to the expectations. The video here is designed to supplement the written agreement. We want you to read the agreement very carefully before you sign it. If you have any questions, please ask any of the staff members for clarification. Again, this is to supplement and not replace your reading and signing of the agreement. A copy of that agreement, if you do not have one, is available on our website. It is important to understand that opioids are very dangerous medications. There is the opportunity for abuse, misuse, and diversion. However, there is evidence to show that the use of opioids can be very effective in treating pain, and in particular chronic pain. However, they must be used with great caution. One of the main items in our agreement is that there can be no self-adjusting of the medication without the physician's approval. Many patients, when they have a bad day of pain, have increased pain, are somewhat likely to take more medications than they are allowed for that particular day. Similarly, if they have a day when the pain is somewhat better, they're more likely to try to cut back on their medications, assuming that this is the proper and beneficial thing to do. However, this can create significant problems with increased side effects, miniature withdrawal symptoms, and it makes it difficult to assess the efficacy of the particular medication. So it is important that you take the medications as prescribed, as written. If you think it would be beneficial to do otherwise, you will need to discuss this with the prescribing physician. Another point is the medications must be locked and secured. By this we mean that they have to be in some type of cabinet, cupboard, safe, gun safe, something that can be locked to protect the medication from anybody else getting to it other than yourself. Many of you may not have children at home, you may live alone, you may just live with your spouse and believe that the medicines are safe from anybody getting them. Unfortunately, we have had patients who, even though they don't have people in the home, oftentimes the homes will be broken into and the medicine stolen. For this reason, we must insist that the medications be kept secure under lock and key. If it is determined that you have problem maintaining security over these medicines, we may have to reevaluate our ability or willingness to continue to prescribe. You must understand that lost or stolen medicines may not be replaced. So it is important to keep track of the medicines, know where they are, and that only you should be maintaining possession of these medicines. We must prohibit the use of alcohol or illicit drugs. Many patients like on the weekend to have a beer while they're watching a football game, maybe to enjoy a glass of wine in the evening. However, the use of alcohol can cause a variety of problems. So in our agreement, we emphasize that alcohol use of any type and any quantity is prohibited. This may create a problem for some of you who enjoy a little bit of alcohol from now and again, but in order to protect you and to protect the clinic and to get the maximum benefit out of the pain medication, we must insist that you not use any alcohol or illicit drugs. Drug screens will be undertaken on a routine basis. It is important for us to be able to document that the medicines that we are prescribing are indeed being used by the patient. It is not uncommon that an agency might review the chart to determine the presence or absence of the drug. This is the other reason for taking the medications only as prescribed. If you cut back on your medications, or in particular, if for some reason or another you discontinue it for a day or two, then it may not show up in the drug screen, and therefore we cannot confirm that you're taking what is being prescribed. If we cannot document that you're taking the medicine that we're prescribing and taking it as prescribed, then again we may be compelled to reevaluate our use of that medicine. You must protect the medicine. We don't want you misusing it, and one of the most common forms of misuse or diversion is that medicines tend to be shared perhaps with family members. Only the person whose name appears on the prescription is entitled to the medicine. I am aware that things may occur where perhaps somebody in the family has a headache or some type of pain problem, and it would be tempting to share the medicine. That person, however, must have their problem addressed separately. You cannot share your medicines with anybody. Only the person whose name is on the script can use the medicine. There are, unfortunately, with the increased use of these medicines, fatalities have occurred. More commonly, they tend to occur when people who the medicine was not prescribed for have access to the medicine and take it without perhaps realizing or being educated as to the potential effects of that medicine. It is also important that you participate in making your appointments on time. The clinic is a busy clinic, and there are many patients that we have to serve on any given day. We realize that extenuating circumstances can occur. We ask that if you have a problem with making your appointment, that you notify us at least 24 hours in advance. Missed appointments, particularly on a regular basis, can be construed as a non-compliance with the medical agreement and may result in, again, our having to reevaluate whether or not opioids and other substances can be prescribed in an effective manner. Chronic pain, as we will see in other presentations, is a very complex and complicated problem. Medications never have been and never will be the solution to this problem. For that reason, you will be asked and required to participate in other therapies and other treatments. This may include viewing and participating in the series of pain management education classes, periodic follow-up with one of the pain psychologists, consulting with the physical therapist for a musculoskeletal examination, home-based exercise program, and the use of other modalities. We want you to think of this medicine much the same as you would of taking insulin for diabetes. Insulin does not cure diabetes. It helps to control it and stabilize it. For the diabetic to get the best benefit they can, they must exercise, watch their weight, watch their diet, proper nutrition. The same thing is true with pain. These medicines are a means to an end. They are not an end in and of themselves. An important aspect is combining other therapies with the medicine in order to get the maximum benefit with the least amount of medicine. It is for this reason that our agreement and the clinic is focused on improvement in quality of life, even over pain relief. Yes, we are interested and do want patients to have less pain. But the primary reason in our setting for prescribing controlled substances such as opioids is their ability to help the patient to have a better quality of life. So you will find us asking on a regular basis, what are you able to do that you hadn't been able to do before? How much more active are you? I can tell you with absolute certainty, having done this for over 30 years, that the chronic pain patients who do the best in the long run are not the people with the less pain. They are the people who, in spite of their pain, develop a satisfying quality of life. So functioning, quality of life is going to be important, and we may even ask during the evaluation what things you want to be able to do that you're not now doing, and use that as part of the assessment as to the efficacy of the medicines. Another important aspect of the agreement is that you cannot share, sell, or trade medications. If this kind of behavior is uncovered, it could result in immediate discontinuation of your treatment and discharge from the clinic. Medication adjustments can only be addressed at your meeting. Calls at night, on the weekend, will not result in changes of the medication. If you have concerns, you can call in for an earlier appointment, or otherwise you must wait until your regular appointment to seek out adjustments in your medication. We do ask that you not obtain medicines for problems that we are treating you for here in the clinic from other doctors. If there are multiple prescribing physicians, this may result in medications that can have negative impact and interaction. So as long as you are being treated in our clinic for chronic pain, We ask that you not obtain medicines from other physicians for the treatment of your chronic pain. Furthermore, it is critical that we be aware of any and all medications that anybody else is prescribing to avoid overlapping prescriptions and avoid negative interactions with these medicines. It is therefore very beneficial for you to maintain an updated and detailed list of the medicines you're receiving, what you're taking over the counter, which doctors you're seeing, and bring that with you to your appointments. Whenever possible, we want you to use a single pharmacy. We realize that in this day and age, and because of some of the limitations on medicines, that some pharmacies may not be able to maintain an adequate supply of the medicines that are being prescribed. However, whenever possible, we would like you to use a single pharmacy. The agreement also specifies that you allow us here at the clinic, the physician, psychologist, the professional staff, to contact other individuals or agencies where we might be able to obtain information to further help or guide your treatment. This may include family members or other pharmacies or other physicians that will give us information to help. It is important that we maintain tight control of these medicines, so we will have to ensure by talking to other individuals that you are not securing medicines from other places and doing what is frequently called doctor shopping. You must be aware that there may be times that you will receive a call and ask to come to the clinic either for a pill count or for your drug screen. These may oftentimes occur when you come for the regular meeting, but there may be times that you will receive a call at home and we will ask you to come in within a relatively brief period of time so we can do an updated count or drug screen, which allows us to confirm that you're taking the medicines on time and as prescribed. Sometimes, despite all of our efforts and all of your efforts, the pain problem will spin out of control. That no matter what we do, we are unable to help you to control your pain. On rare occasions, we ask that patients participate in other treatments that might involve going to the hospital to help to reevaluate your status, your pain problem. It may involve titration off of the medicine to reevaluate which medicines would be beneficial and the amount that needs to be given. You must understand that it is virtually impossible, and there is no evidence to suggest that this medicine or any treatment will control your pain 24 hours a day. There is a limit to what we can prescribe, and beyond a certain limit, we run the risk of side effects and harming you. So there may be times that you will have to adjust, as it were, to our medicine. Now, what this means is if you are not getting the full length of relief, you may want to plan your activities around the period of time when you're getting maximum benefit from the medicine. So if you are planning a trip to go shopping, you might take your medicine in anticipation of this trip so you can more easily go about performing your activities. Increasing the medicine, as we've indicated before, would not be acceptable without permission from the physician. It is important to understand that when traveling with medicine, you must take significant precautions. Do not mix several medicines into some type of container. Do not carry them loose in your pocket. Do not place them in your purse or some bag. Medicines must be in the individualized container. The medicine must be in a prescription labeled bottle that shows who prescribed it, what the medicine is, how you're supposed to take it, where you filled it, and when it was filled. If something unfortunate happens and you were to be stopped and asked about the medicine and asked to show the medicine, if you did not produce a prescription labeled bottle where the law enforcement agency could determine exactly where the prescription came from and when it was filled, there may be the chance that you would be taken under custody and be charged with possession of a controlled substance. One of the ways of helping this is when you get your medicines filled, if they tend to come in a large bottle, you can ask your pharmacist for what is called a travel bottle. This is a smaller bottle that can contain a small amount of medicine, but it still has the label on it indicating who prescribed it, when it was prescribed, where you got it filled, and when you got it filled. It is beneficial to always carry a list of all of your medicines and also all the physicians that are prescribing. Remember that these substances can cause significant side effects and complications. We will discuss these in greater detail in the tape that deals with pain medications. But to review some of these so that you can have a clear idea of the potential side effects, you can become physically dependent on the medicine where if it is stopped, you would have withdrawal syndrome. You might become tolerant, meaning the medicine might not work after a period of time. You could develop a condition which is called opioid-induced hyperalgesia. This means that the medicine has affected the way the body and the brain works and might actually get to the point of facilitating or causing increased pain. Addiction can occur. This is especially true if in your family members there have been individuals who have had problems with drug or alcohol, or if you yourself in the past have had some problems with drugs or alcohol. This is why we go through a detailed assessment to help to identify people who are at risk for this and then undertake some risk management strategies. Constipation, especially with opioids, is not uncommon. It can be dangerous. The American Medical Association recommends that you have at least 3 to 4 good bowel movements per week. So we will be evaluating this, and there may be occasions when we have to change, alter, or even discontinue opioid medications if constipation becomes so severe. We may need for you to consult with a gastroenterologist for assistance in this manner. Hormonal alterations are common. We are able to check some of that in the clinic, but you should be prepared to make a referral to an endocrinologist or your primary care physician to do an evaluation of your hormonal status. This is a finding that has emerged in the last couple of years, and activity involving alterations in hormones can affect pain, can affect bony deterioration, and this can occur with pain medicine. There is evidence that opioid medications can compromise your immune system, which means that you would be at higher risk to obtain an infection and you would have a greater difficult time getting rid of the infection. This is another reason to monitor your system carefully, stay in contact with your regular physician, and do everything you can to maintain maximum health, including watching your weight, discontinuing smoking, exercising, watching your diet. On occasion, pain medicines can make thinking and organizing of your thoughts a bit more difficult. This is most likely to happen when you make a significant adjustment. If the medicine is maintained stable over 2 weeks, it is less likely to happen, but that does not mean it will not happen. This is another reason that we insist that you not self-adjust your medicine. Simply adjusting your medicine by 1 pill a day, going from 3 to 2 or 2 to 3 pills, may change the effect of the medicine on your ability to think, concentrate, remember. There is a phenomenon called dry mouth syndrome. Some of these medicines will result in a reduction in your production of saliva. If you produce less saliva, it will have a higher acid content, and that can cause erosion of the teeth, erosion of the jawbone, dental caries. This is something that needs constant monitoring, and you should address this with your physician. If you have any sense of a cotton mouth or dry mouth, bring it to our attention immediately, and I'm sure that we will ask you to follow up with your dentist to have that evaluated. Liver abnormalities are not necessarily uncommon. They are of special concern in medicines that contain Tylenol. For this reason, we may try to restrict the medicines containing Tylenol in our prescribing patterns. However, in some instances, the medicines that contain Tylenol can be more effective. If you are taking medicines containing Tylenol or using Tylenol over the counter, it will be important to have regular lab work and to get updated assessment in terms of your liver function studies. These are a few of the highlights of our medical agreement. If there is noncompliance that is found, if there is unusual behavior or what we call aberrant behavior, frequent calls to the clinic, not showing up on time, asking for early refills, overuse of the medicine, running out of the medicine early, the presence of alcohol or illicit drug screens or in your drug screens, or the absence of our medicine in the drug screen, then you will be seen by one of the pain psychologists who will review the evaluation, will review your manner of compliance, and then discuss with the medical team and the physician whether or not there needs to be a change in your protocol and in your treatment plan. We ask that you take this very seriously. Again, this video is not designed to replace the agreement but to supplement it. We want you to read that agreement very carefully. We would ask that you share that with your spouse or family members so they are equally aware of the requirements of the agreement. We want to be here to provide you the best, safest, and most effective therapy we can, but this depends, again, on your involvement, your following through on your responsibilities, and your being compliant with our medical agreement.